Thank you, Speaker. My question is to the Premier. Unlike the Premier, I want to thank the Auditor General for her report that she tabled yesterday. All her findings were signed off by officials. The AG notes that when testing and contact tracing is done effectively, a person's likelihood of transmitted COVID-19 can be reduced by 80%. That's why Ontarians were shocked to read that the province was delayed in expanding testing capacity, despite warnings to the Chief Medical Officer of Health by Public Health Ontario. It has long been clear that the government's plan has been, and response to COVID-19 has been opaque, reactionary, and marked by disorganization, secrecy, and chaos. Now we know that the Chief Medical Officer's advice has been filtered by a political committee. Ontarians deserve answers on how our leaders are making decisions with life and death decisions. We have just cleared another grim milestone of deaths. Speaker, through you to the Minister or the Premier, will you commit today to work transparently with public health officials instead of working around them to restore the trust and confidence?
Thank you very much. Minister of Health.
It's hard to know where to start with that question. First of all, on the assertion that the Auditor General made that her report was signed off by the Deputy Minister of Health, that is not the case, nor would it be appropriate for the Deputy Minister to sign off. That is a decision for elected politicians to make. What the Deputy Minister signed off on was, as I indicated earlier, was a document indicating that she had filed and provided all of the information that the Auditor General had requested for the purpose of her investigation. But she also attached 21 pages of factual inaccuracies that were not dealt with. And I think that's really important to remember in the context of the Auditor General's report. There are some comments that she makes with respect to some systemic issues, which we of course accept. Some of them relate to the failures of the previous government, their failure to act, their failure to update their pandemic response plan since 2013.
Thank you very much. Thank you. And the supplementary question.
Thank you, Speaker. Speaker, I'm not going to quibble about who signed off on the report. This government has a very poor record of officials signing off on their reports. The government's delay and fractured leadership has severely hampered the ability of public health units to carry out this process effectively in response to COVID-19. In October, the Toronto Public Health was so overwhelmed that it made the difficult decision to suspend contact tracing outside of outbreaks in congregate care settings. These local units need support, Speaker. They are now being asked to do more by this minister and this government. They need funds to do outreach in COVID hotspot areas. They are asking for this support. And despite the downloading of responsibilities to the public health units, this government has not provided any additional funding since the outset of the pandemic, and they were shamefully left out of this government's recent budget. Speaker, through you, back to the minister, will you commit today to adequately funding public health units to do the important work that this province requires and that they are asking for?
Thank you very much. Minister of Health.
Thank you, Speaker. To say that I disagree with everything the member opposite said would be a huge understatement. We have put money in, we have put billions of dollars into protecting the health and well-being of the people of Ontario. We have put over $1 billion in testing, tracing and contact management. We have put extra resources into the hotspot areas, into Toronto and Peel. We are moving forward with all of the recommendations that we were given by the Chief Medical Officer of Health and the many other public health officials who have knowledge of what needs to be done here through Public Health Ontario, through the Public Health Measures Table, and the many, many public health physicians that stand behind them that are volunteering their time. To suggest that we are not acting on their response is completely wrong, because again, I have to speak for the numbers. They speak for themselves. If we were doing everything wrong, why does Ontario stand #1 in North America in terms of the lowest number of cases per 100,000?
Thank you very much. Thank you. The next question, member for Mississauga, Streetsville.